So, I mean, you talk to 5,000. I mean, let's just look at those numbers. This weekend alone, I did a bit of calculations. 9,587 cases on Friday. No, not Friday. That was on Saturday and yesterday, just those 2 days. So 4,500 new coronavirus infections in 24-hour period. The total number of infections is now at an alarming trajectory. We're almost close to 100,000 infections as we quote numbers at this point in time. And this figure is steadily climbing every single day. 100 deaths almost this weekend as well. Joining us to discuss this and other COVID-19 related issues, again, we're so happy to have the Health Minister, Dr. Zweli Mkhize. Great to have you, Minister. Thanks again for joining us.
Thank you very much, Leanne and Sakina and all the viewers.
Minister, I mean, I'm going to start off a little off track here. I don't know. I don't think you've got visuals in front of you, but you might in terms of what's happening right now with the taxi strike and with desperate commuters trying to get to work. No things such as social distancing. People are desperate right now. They're climbing into anything to get to work. They're standing in queues on top of one another. They're jamming themselves into vehicles, buses, anything that they can. This is a mess. It's a mess, Minister. What are your views?
Well, it's very unfortunate that we have to deal with the kind of difficulties that we have to face. In the first instance, I think the Minister has indicated that there are limited resources, and these resources have been extended to support the taxi industry. And really, we believe that we should work together to try and ensure that we can, whilst we're opening up the economy, we also try and assist the communities so that we don't spread the infection. Now, it's going to be very difficult to manage this whole situation because we've just come from the lockdown and everybody has been complaining that they have no problem, they've got no access to work, and they need their income and the economy is going down. And it is true. We needed to make sure that this is balanced properly. At the same time, there's a huge amount of infection that is still raging. The fact that we have said we are lowering the restrictions does not mean that, in fact, we have gotten rid of the infection. If anything, the infection is much worse now than it was at that time. However, we have benefited from the delay in the past 3 months. The numbers could have reached this figure much earlier when our hospitals were not ready, when our people were not ready. They didn't even understand what they need to do to actually fight this virus. So now we need everyone to cooperate. We need everyone to understand that we need each other. We have to support each other. And therefore, what would be important now is for people to understand there's nothing more important now than to create conditions for people to be able to avoid the spread of the infection. Because even though there are challenges in the various aspects of the economy, we can manage if we make sure that everyone is wearing a mask and there's distancing and that people use hand sanitizer. But if we create a lot of tension, we basically mean that all that really remains is for people to only focus on survival. How do you get to work under all conditions? So the whole idea of keeping a distance is actually thrown away. We really need everyone to cooperate. We need everyone to support.
Yeah, we certainly do, and it's looking less like that wherever you go. I mean, when you do go into South Africa now, obviously people are desperate to go out and start earning money, get back into the work environment, and to get their lives going again. And I mean, sometimes, and one of the comments that I hear, and I hear this all too often, is that what government are saying and what government are allowing people to do are completely contradictory. I mean, even you said so at the beginning, it was last week, the end of last week, when we had an interview that has really stuck out in my mind, was you're saying we are now entering into the eye of the storm. And these numbers that we're speaking to, almost 10,000 infections reported just this weekend, is really confirming what you're saying. But we're opening up South Africa in such a dramatic way. Casinos, salons, massage parlors. It's like, you're telling people to go out there, do what you want to do, but be careful. It's really tough. I know it's a difficult situation, but how do we handle this situation going forward, Minister?
Well, just remember how even the media was screaming and saying that there's no more support for lockdown. and people were now starving, the government was starving people, and all sorts of attacks were actually out there in the media. The reality is that it's a very difficult balance to try and maintain, and we are conscious as government on both sides that we do need to make sure that people understand the spread of the infection, that we contain to the extent that we can the spread of the infection. But at the same time, we need to get people to get used to a new way of opening up the economy, a new way of going to work, a new way of going into taxis, a new way of conducting your church services, a new way of going to school. All of this means that unless we adapt to that, we haven't got a hope of ever defeating this virus. The numbers that have already increased indicate that those numbers are increasing in such a way that, all that we're going to be having is that every day we're going to be taking people into hospitals. Whereas we can do something as we open the economy, we can actually slow down the rate of the spread of the infection. It's a very difficult balance to make, but it depends on the consciousness of our own people. It depends on all our people understanding that each and every one of us has a role to play. If we take a more selfish approach to say, this is my interest, this is what I want to do, and forget about caring for the others, it really makes it very, very difficult. So in this case, our request would still be that the matters that relate to the opening of the economy, the movement of transport routes, need to be negotiated in such a way that we are able to support each other. At the end of the day, we need everyone to go back to work. We do have a challenge as to which area of the economy you can close, which one you can't. In fact, literally everybody is ready to go to court to force the government to open because their livelihood is also affected. Now, we have to try and balance all of this up. It's not an easy issue, but there is no way you are going to actually hold the people in a lockdown forever when you have got a situation where this viral infection, this pandemic is going to be with us for more than a year, maybe even 2 years. So because of that, it means that we must adjust to a new way of doing things. It would be much better if all of us take the advices that we give so that we use that to change our behavior, than to wait until you now see so many people who are now succumbing to the infection. And that's the only time we start changing our behavior, because that will be too late already. Already right now, the numbers of those who have succumbed are counting very close to 2,000. Those numbers will quickly start rising. They'll rise very quickly. The numbers of people, we're talking about the 97,000 today, but in a few weeks, we'll be talking about several hundreds of thousands. And that actually is because of this behavior. This is what you are seeing now. Wait for 2 weeks. You will see the impact of how the recklessness that we would have actually seen now, how it will actually translate in the numbers of more new infections that are going to be coming. The real risk is when those numbers are so huge that even our hospitals can't cope. We've managed it so well up to now. We need to really maintain the balance as we move into the next few weeks.
And sometimes it is difficult decisions that government needs to make. The difficult decision was to originally cut off all movement and to say, we're in lockdown, we need to get hospital beds ready. You say that has now been done. We're now finding ourselves in a situation where we're getting 10,000 infections every 2 days. I mean, I'm just going by the numbers that were reported over this weekend. Is there a threat, and I ask this to you in an open and transparent way, is there a threat that South Africa, if we continue at this rate, we will go back into a tight lockdown again?
Look, you can never rule out the possibility of a lockdown. Most likely, the lockdown might be localized into a district, into a province. It might not necessarily be right across, because what we did find, we did the screening and testing, we realized that the different parts of the country don't have the same level of transmission. There are areas which we call low transmission. There are areas which are hotspots. There are also areas where outbreaks. So the interventions that we have to put into all of this are important interventions. In this case, what we would then say is it's very possible that we might actually go into a particular area and designate it that it becomes necessary to put more restrictions. which really is a kind of localized lockdown like what we might have seen in China in the province of Hebei in Wuhan city, those possibilities exist. And I think we mustn't linger, because we think that we are now over the problems. We need to understand that there will still be a need for tough decisions to be taken into the future, and we can't rule that out. And so, depending on where we see that the numbers of people who are infected is going very high, and that at the same time the numbers of beds are threatening to be overwhelmed, or the numbers of staff are going to be overrun, we might have to do that. We have to take very strict actions at that level, including some of the issues around the restrictions on the use of alcohol. If we think that so much of trauma is coming into hospitals and occupying theaters, casualty wards, and ICUs, and yet we need it for COVID-19, of course, we will have to consider even those possibilities of restricting those the sale of alcohol. So all of those things are on the table. We haven't decided on any of those. We just need to understand that government will have to do everything that needs to be done. If it's necessary, there will have to be more, action that will need to be introduced. So we are watching the numbers. We are actually also watching the behavior of people. If people have learned and are able to cooperate and assist the process, so that we don't have an increase in the numbers. But we can't say that we're gone now. There will never be any restrictions. We might have to go back there. So I think we need to understand that it's difficult choices. It's not because government wants to do anything, but if we have to protect the lives of people, there are lots of things that we'll have to consider. At the moment, what we're trying to do is to balance their lives and their economy, their lives and their livelihood, because government will not be able to offer additional social grant to everyone forever. Government will not be able to offer income grant for the unemployed forever, and government can't be distributing food parcels forever. So we need people to work for themselves, and a normal life must be introduced. We've seen other countries have been able to do so, and because we've seen it work in other countries, we do believe South Africans actually will understand when there's a need for us to adopt a particular approach that will help our country to survive. But yes, any restrictions may still be introduced, so we can't say we're gone and gone, there will never be such. There may well be. So when that situation arises, we'll obviously have to discuss it directly. It will have to be clearly indicated that in this case, this is the problem. But the fact that we have tried to ease in a gradual way, it has really been because we're trying to help to balance people's adjusting to a new behavior, and also economies adjusting to a new way of screening people when they come to work, of ensuring that people are not overcrowded at work, people don't come in if they've got symptoms, people if they've got fever, they can be tested before they come in so that they don't infect the others, that we test those that we find to be positive, that when there's people who are infected, we might have to close down, to deal with those who are not well, treat them, and take them for quarantine, reopen. It's going to be a stop-start in a number of areas, but really what we need is cooperation from all.
We haven't seen any of what you're speaking about right now in terms of specific shutdowns in different areas or metros or whatever it may be. I mean, let's just focus on the Western Cape for now, because the Western Cape, of course, still being the epicenter of the virus, it has been now for quite some time. Just the numbers that we're looking at: confirmed cases 51,441. The death toll in the Western Cape alone is at 1,419. In terms of containing this, in terms of perhaps bringing about something dramatic in the Western Cape, has that been discussed? I mean, when is the Western Cape expected to reach its peak, and where to next? Where are those numbers expected next?
We can't give you any specific numbers. I've avoided getting drawn into giving specific numbers. What I suggest we should be doing is to focus on what we're asking people to do, and that is the change of behavior. Now, if you look at what happened in the Western Cape during the lockdown, the first lockdown, we ended up with a number of people who got infected at that time. This is what we call the cluster outbreaks. Now, these clusters happened in areas where, retail shops, in factories, food processing plants, and so on. Now, those were actually closed. So every now and again, there were several shops that had to be closed down as we're testing people, and we found that some of them were positive and so on. A lot of that was done at that point. And in some of the areas, like in the Ceres Valley, in the area of Wittenberg, they were able to even contain the numbers and reduce them down from about 360 to something like 30 or so at the time. So we were able to see that with a concerted effort, we were able to change the rate of the infection. Now, in the Western Cape, as we sit now, our challenge at the beginning was the tracing of contact was very weak. We had a huge gap. At some point, we had about 17% gap between those who were identified and those who were contacted. And we worked on this. We've even now worked together to ensure that we put even a track and trace program. Now, the issue is that we have increased the numbers of beds that are available for quarantine and isolation. We're now finding reluctance on the community to go into quarantine and isolation in some of the areas. Now, this is something that we are working on. We've even called upon social partners, NGOs, community leaders, church leaders, to go and talk to the communities there, because the delay in getting people to be quarantined is really where the incubation of the virus is taking place. And so this has to be avoided at all costs. In the rest of the provinces, we've sent the message very strongly that they must also focus that we don't end up losing the opportunity of breaking the cycle like we are seeing in the Western Cape. We have to talk to the community, because at this point, the real challenge is the community's attitude. People are asking questions, why should I go for quarantine and so on. Now, you can actually enforce some of the situation, especially for those who are positive. But the contacts have to be asked to go into quarantine, even if sometimes they've not been tested as positive, because that's the only way you are able to contain the infection. And people need to understand that it's not going to be easy, but it is necessary that we must use that approach to contain the spread of the infection. So we have to continue doing that work. We are on a continuous discussion with the provincial government to be able to see what else needs to be done. We've asked our ministerial committee to also focus on this particular area. We are in daily contact with the leadership. We've also sent reinforcements to the Western Cape. We've even broken the whole thing down, the districts down to sub-districts. We've got teams of community health workers and public health nurses who are going out to talk to various members of communities and explaining to them, looking for those who are vulnerable, explaining to them, they're sending leaflets, they're sending messages on their cell phones to say, we would like you to consider going for quarantine and all of that. So we have to just emphasize on that. At the end of the day, South Africans have to take the option of working together to stop the spread of the infection. Now, as you would have noticed, there's been so many court cases where anything that government has done is being challenged in court, almost creating an impression that the government is irresponsible, the way that we've put up certain regulations and so on. All this now is actually becoming a challenge, because now all the restrictions that have been called for are being reduced, not really because of pressure, but more because of the necessity to try and balance the economy and this reducing the rate of the infection. People have to take a very strong sense of responsible behavior so that they can then change the way that the virus can spread. It's really up to our people to do that. And that, for me, is what we need to really emphasize as we discuss with all our community.
Minister, we've entered into our news time, but I just want to wrap up this interview looking at the age of the number in terms of age grouping and deceased. I mean, we see that there's basically between the ages of 60 to 69 seem to be the highest grouping that have died in this. 506 people in the age group 60 to 69. The next is 50 to 59, 471, and then 342 deaths in 70 to 79. So again, showing the correlation between age and coronavirus and whether or not you can come through this. So this is something that we need to look at quite carefully. And one other aspect that hasn't really been brought up is when you're bringing out these particular numbers and the statistics that come out, we never see race being spoken to. And a lot of people ask for race, a racial breakdown of those that have died of coronavirus and perhaps any other underlying issues, because some people still believing that this is a white man's disease and that nobody else is affected by it. Is this a trajectory or a thought process that the ministry may consider bringing out and releasing?
We have tried many times to explain that this is not a black man's disease or a white man's disease. It's a disease that's affecting human race. It has affected people in China, in America, in Europe, in Brazil. I don't see why people should think that there's a particular racial classification that can protect someone from getting an infection. It's really not correct to think like that. However, when we started recording all the patients who were being tested, we didn't ask them or to explain whether they were black, were Indian, they were colored, they were white, and so on, largely because over the years, that classification has been seen largely as offensive as in society. So when we get the specimen already, we find that the doctors who are doing the test have not really asked the person to declare which race group they come from. We have now since started now to record that so that we can share that as it's been asked a few times by members of parliament. We are doing that, but there will be a number of people who were tested earlier where this was not specifically made available. You'll also be aware that for a while we also had a number of instances where the provinces where people came from was very difficult to find, and were to make a very strong plea to the doctors and the laboratories to find that information so that you can utilize it. But the long and short of it is that, all South Africans have been affected by this infection. Of late, of course, because of the majority being black people, the majority of those who are infected and those who are dying is going to be black people. Now, the exact numbers, it's going to take us a while to be able to get all of those numbers properly recorded, because in some instances, people refuse. If you ask someone, are you colored or Indian or African or what, they may not actually give you that. If they refuse to answer that question, that's up to you. You will not be in a position to then stand up and classify that individual. So it's becoming a bit of a tricky issue, but we will now be trying to get as much of that information as possible. I'm not sure when it will all be so reliable that we are able to release it to the public. We have noted that, but the point which is important for us is that, as we have rightly pointed out, the numbers of people who are dying tends to increase with age. It also tends to increase with additional diseases, comorbidities, and the more comorbidities, the more the chances are of someone being compromised. The higher the age, the same. So the numbers start rising from around 45 upwards, but certainly from 50 to 59, 60 to 69 and 70, that's the bulk of the people who are dying at that level. And this experience right across the different parts of the world, that people at that level tends to be the one who succumb to the infection. So we will be releasing those stats when the racial classification is well documented. We'll also make that available.
Mkhize, your time is gold to us. Thank you so much for being with us as always and giving us your answers. These are questions that South Africans desperately are asking, and you are there to answer them, and we thank you for that. Health Minister Dr. Zweli Mkhize giving us the latest update on COVID-19 pandemic in South Africa. It's 5 minutes.